Hello everyone, today we will start our journey of anatomy and we will start it with the basic book of anatomy, that is General Anatomy, which includes the terminology and all the basic systems of our body. Until you understand all the topics from this book, you can't understand the regional books, means different parts of the body. Okay, so it is very important book for all the students. So let's start our journey with introduction and terminology of anatomy. First of all, definition of anatomy. The definition is very simple. It is the science that deals with the structural organization of human body, internal or external. It is the structure of the body and science that deals with that structural organization. Okay, so it's very simple definition. Anatomy is actually a Greek word which is derived from anatom, and the meaning of which is to cut up. कट करके जो स्टडी करते हैं उसको बोलते हैं एनाटॉम, और एनाटॉम से डिराइव्ड हुआ ये वर्ड एनाटॉमी. द लैटिन मीनिंग ऑफ दिस इज डिसेक्शन और डायसेक्शन. Dissection is actually just a technique, while anatomy is a wide field of study. Okay, now we will discuss the subdivisions of the anatomy. The first of this subdivision is macroscopic or cadaveric or gross anatomy. So study on the dead bodies by dissection and observation of the structures with naked eye is called macroscopic or cadaveric or gross anatomy, and it is studied under two headings: regional anatomy and systematic anatomy. Means बॉडी को, डेड बॉडी को कट करके उसको ओपन करके उसके जो भी स्ट्रक्चर्स है वो नेकेड आई से हम जो स्टडी करते हैं उस टाइप की जो एनाटॉमी है, दैट इज कॉल्ड कैडेवरिक, माइक्रोस्कोपिक और ग्रॉस एनाटॉमी. Regional anatomy means when we study anatomy by dividing it into the different region, it is called regional anatomy. So we will study it by dividing it into head and neck, thorax, upper limb, abdomen and lower limb. So mainly these are the 5 regions under which we will study the anatomy. Okay, so this type of study is called regional anatomy, and another variety is systematic anatomy, means study of the anatomy system wise. For example, cardiovascular system means when we study the heart and blood vessels, it is called cardiovascular anatomy. When we study about the functions and organizations of the respiratory system, means lungs and trachea and all that, it is called respiratory anatomy. Same way, GI tract, nervous system, urinary system, skeletal system, muscular system, endocrine, reproductive, integumentary, lymphatic and articular system. So when we study anatomy by dividing it into different system, it is called systematic anatomy. The second subdivision is living anatomy. When we study on a living human being by inspection, palpation, percussion and auscultation, it is called living anatomy. See, now these 4 words are new for you. What is inspection? Inspection means to observe. जब हम देख के उसकी स्टडी करते हैं लिविंग पर्सन को, that is called inspection. Palpation, when we study that structure of a part of a body or organ, when we study it by touching it, this is called palpation. Percussion, so when we study it by tapping it, it is called percussion. And auscultation means when we study it with the help of auscultation means stethoscope, that is called auscultation. So in the living human beings, when we study the anatomy by observing, by touching, by percussion and by auscultation, it is called living anatomy. The next subdivision is embryology, study of the intrauterine developmental changes in an individual which begins with fertilization and ends with the birth. Intrauterine, uterus, you all know, it is the womb, garbhashay. So intrauterine developmental changes means womb के अंदर जो डेवलपमेंटल चेंजेस होते हैं, मीन्स जब स्पर्म और ओवम का फर्टिलाइजेशन होता है और फिर उसमें डेवलपमेंट होते हैं और एट द एंड इट गिव्स अ बर्थ to baby, means it is the process from fertilization to birth, journey of embryo from fertilization to birth, that is called embryology. The next subdivision is histology or microscopic anatomy, the structures that we can't see with our naked eyes. We have to study it with the help of microscope. Okay, so very fine, very minor structures we have to study with the help of microscope, and study of that kind is called microscopic anatomy or histology. The next subdivision is surface anatomy, study of the deeper part of the body in relation to skin surface. स्किन का जो सरफेस है उसके रिलेशन में अंदर कौन सा ऑर्गन है, वो बाहर से जब हम मार्क करके फिर उसकी स्टडी करते हैं तो उसको सरफेस एनाटॉमी कहते हैं. फॉर एग्जांपल, हार्ट इज सिचुएटेड ऑन द लेफ्ट साइड ऑफ आवर चेस्ट, राइट, दैट यू ऑल आर अवेयर ऑफ. सो जब रफली उसका स्केच या बाउंड्रीज हम लेफ्ट साइड ऑफ चेस्ट पे ड्रॉ करके बताते हैं कि इतने एरिया में हार्ट होगा, तो क्या हुआ, स्टडी सरफेस से हम डीपर स्ट्रक्चर की स्टडी किया. That indicates the study of the deeper structures from surface, that is the surface anatomy. The next subdivision is radiological anatomy, means study of the deeper structures by taking X-rays and sonography, that is radiological anatomy. Comparative anatomy means study of the anatomy of the other animals to explain the changes in form, structures and functions of different part of the human body. You all might aware of the vaccines, okay, and drugs. Many scientists and researchers are developing, inventing the vaccines and these drugs. They are experimenting that drugs and vaccines over the animals. They observe the changes in that animals, and after that successful trial they implement that drug or vaccine over the human. So when they introduce particular drug or vaccine in that animal, they observe the changes, and after they introduce it into the human, they also observe the changes. So they compare these changes of human and animals, and by comparison they decide the positive and negative factors of that particular vaccine or drug. So this type of comparison is called comparative anatomy. The last is applied or clinical anatomy, that deals with the application of anatomical knowledge to the medical and surgical practice. Anatomy का जो knowledge है उसको हम routine practice में, medical और surgical practice में जब apply करते हैं तो उस टाइप की स्टडी को अप्लाइड एनाटॉमी या क्लिनिकल एनाटॉमी बोलते हैं, राइट. फॉर एग्जांपल, आपको पेट में राइट साइड चेस्ट के नीचे मीन्स दर्द हो रहा है यहाँ पे, ठीक है. आई विल शो यू द लोकेशन. इफ यू हैव अ पेन over here, right, just below the right chest over here. So आप जाके क्या बोलोगे डॉक्टर को डायरेक्टली? पहले दर्द हो रहा है, राइट? तो डॉक्टर क्या पूछेगा आपको? एग्जैक्ट कहाँ पे हो रहा है? तो आप साइड दिखाओगे, तो वो साइड पे क्या है अंदर? तो लीवर है और गोल ब्लैडर है, ठीक है? तो डॉक्टर सोचेगा कि आइदर देयर मस्ट बी ए प्रॉब्लम इन लीवर और गोल ब्लैडर। फिर वो टाइप ऑफ पेन पूछेगा कि हैवीनेस जैसा फील होता है या पिन पॉइंट पेन है। फिर वो उसको टैपिंग करके मीन्स परकशन करके चेक करेगा कि वो सॉलिड स्ट्रक्चर फील हो रहा है अंदर या सॉफ्ट स्ट्रक्चर फील हो रहा है, ठीक है? उसके बाद ही विल गो फॉर इन्वेस्टिगेशंस लाइक सोनोग्राफी और एक्सरे और ब्लड टेस्ट, यूरिन टेस्ट, whatever he thinks required for that। तो ये सब कब पॉसिबल होगा? अगर उसको पता ही नहीं होगा कि ये जगह पे कौन से ऑर्गन्स है अंदर की तरफ, तो कैसे डिसाइड करेगा कि कौन सा ऑर्गन होगा और कौन से ऑर्गन में प्रॉब्लम हो सकता है और क्या टेस्ट करवाना है? ओके, सो स्टडी आपने की है एनाटॉमी की, तो आपको पता होगा कि कहाँ पे कौन से ऑर्गन है, और वही नॉलेज ऑफ एनाटॉमी जब हम रूटीन प्रैक्टिस में इंप्लीमेंट करते हैं तो दैट टाइप ऑफ एनाटॉमी इज कॉल्ड क्लिनिकल एनाटॉमी, right? So these are the subdivisions of the anatomy. Now few history of the anatomy. So many scientists and researchers are mentioned in the book, but no need to read or even remember all of them. Few are important for the MCQs or one-liners. So this is the list. You can memorize all of them, no need to explain anything in this. Okay, so you can pause video and can memorize these names. Now most important part, that is position of the body, anatomical position of the body. You can see in the picture, this is the anatomical position of the body. Anatomical position means normal position of the body. नॉर्मली बॉडी की पोजीशन ये होती है, बाकी जो भी चेंजेस होते हैं दैट इज नॉट कंसिडर्ड एज इन नॉर्मल और एनाटॉमिकल पोजीशन। हियर द पोजीशन इज बॉडी इज इरेक्ट, आईज लुक स्ट्रेट, अपर लिम्ब by the side, hang by the side with palm facing forward. Lower limbs are parallel with toes pointing forward. So this is the anatomical position of the body. All these structures are described in this position. मतलब ये position normal है और इसकी relation में बाकी के सभी structures को describe किया जाएगा in subsequent lectures. ये normal है, उसके सिवा जो भी आएगा उसका नाम चेंज हो जाएगा, टर्म चेंज हो जाएगी। Okay, so you all have to thoroughly mug up this position, important for viva as well as for theory, one-liner. Okay, so here I am repeating again, body is erect, eyes look straight, upper limb hang by the side with palm directed forward, lower limbs are also parallel with toes pointing forward. So this is the anatomical position of the body. Now the different position, supine position means lying down with the face directed upward. सीधे हम सोते हैं उसको सुपाइन पोजीशन बोलते हैं। अब तक हम बोल रहे थे कि सीधा सोना, चत्ता सोना, but this is now onward you have to tell this position as a supine position. Opposite to it, lying down with face directed forward, it is called prone position of the body. Okay, then planes of the body, median plane, here you can see this is the, in the central you can see this is the median plane which divides the body into right and left half. It is called median plane. Then comes sagittal plane. So any plane parallel to the median plane. सेंटर वन जो है, जो बॉडी को राइट और लेफ्ट पार्ट में पूरा डिवाइड करेगा, दैट इज कॉल्ड मीडियन प्लेन. और उसके पैरेलल में जितने भी प्लेन आएंगे लाइक दिस, दे ऑल आर कॉल्ड द sagittal plane, right? And the third one is the coronal plane, a vertical plane at right angle to the median plane. Median plane ऐसे है तो उसके राइट एंगल में मीन्स ऐसे, लाइक दिस. दिस इज कॉल्ड कोरोनल प्लेन विच डिवाइड्स द बॉडी इनटू फ्रंट एंड बैक पार्ट. उसके दो पार्ट करेगा, फ्रंट पार्ट एंड बैक पार्ट. जैसे मीडियन प्लेन डिवाइड्स इनटू राइट एंड लेफ्ट, कोरोनल डिवाइड द बॉडी इनटू फ्रंट एंड बैक पार्ट. The fourth one is transverse plane, a plane at the right angle to the vertical plane. Vertical plane जो है उसके right angle में. So here you can see from the picture which divides the body into upper and lower half. It is called transverse or horizontal plane. And the next one is oblique plane. Any plane other than above mentioned plane is called oblique plane. ऐसे भी हो सकता है, ऐसे भी हो सकता है, ऐसे भी हो सकता है, कोई भी हो सकता है. जो भी ऊपर वाले हैं मीडियन, सजाइटल, कोरोनल, ट्रांसवर्स, उसके सिवा का कोई भी प्लेन है, दैट इज कॉल्ड ऑब्लिक प्लेन. नाउ द बेसिक टर्म्स, एंटीरियर, पोस्टीरियर, anterior and posterior. Anterior means towards the front and posterior means towards the back. अब तक आप एज अ लेमैन कौन से लैंग्वेज यूज करते थे? फ्रंट और बैक. नाउ ऑनवर्ड्स योर डिक्शनरी विल बी चेंज. बहुत सारी टर्म्स अभी आएगी जो मेडिकल टर्म्स हैं, तो आपको अभी फ्रंट नहीं बोलना है. Now onwards, from today onwards, you have to say that it is anterior, और backward को बोलना है posterior. You can see from the picture anterior and posterior. Then comes superior and inferior. Superior means towards the head and inferior means towards the feet. Then medial and lateral. Medial means towards the median plane. Median plane यहाँ पे था, if you remember in the previous slide, in the center. So towards the median plane, it is called medial, and away from the median plane, it is called lateral. Medial, lateral, medial, lateral, like that. Then comes vertical and dorsal. Ventral and dorsal. Ventral means towards the belly, and dorsal means towards the back. It is almost same as anterior posterior, but these two terms are specifically used for the trunk. Trunk के लिए mainly use होती है, towards the belly and towards the back. Cranial and caudal, they are also same as superior and inferior, towards the head and towards the tail. Okay, so these are the basic terms. The special terms, proximal and distal. Proximal means nearer to trunk and distal means away from the trunk. For example, I am talking about this hand, okay, upper limb. So the shoulder joint, you can say it is proximal, means nearer to the trunk. Shoulder joint trunk से नज़दीक है, nearer है, तो shoulder joint you can say it is proximal to trunk, while this wrist joint is away from the trunk, so it is called distal. The shoulder joint is called proximal as compared to trunk, and wrist joint is distal. Proximal, distal. Then comes radial and ulnar. If you know, this is called forearm. It has two bones. Outer side it is the radius and inner side it is the ulna. So where the radius lies, this border of the forearm is called radial border, and this border is called the ulnar border, means outer border of the upper limb and inner border of the upper limb. Same way in the lower limb, in the leg, tibia bone, tibia is the name of the bone, it is on the outer side, and fibula, inner side, and fibula is another name of the bone, it is situated in the outer side. So when we say tibial, it is called inner border of the lower limb, and fibular means the outer border of the lower limb. Flexor surface, anterior surface of upper limb and posterior surface of lower limb. See, from the picture you can see this is the anatomical position, right? So anatomical position में जो बॉडी का अपर लिम्ब का आगे का पार्ट है, फ्रंट का पार्ट है, मीन्स अभी आगे नहीं बोलना है, फ्रंट नहीं बोलना है, क्या बोलना है? एंटीरियर. तो पूरा जो बॉडी का ये पोजीशन में ये वाला पार्ट एंटीरियर सरफेस बोल सकते हैं इसको अपर लिम्ब में. सेम वे posterior surface of lower limb, they are called the flexor surface. Why it is called flexor? Because flexion occurs through these surfaces. Flexion means folding. अपर लिम्ब में कहाँ से फोल्डिंग होगा? आगे से. लोअर लिम्ब में कहाँ फोल्डिंग होगा? पीछे से. ठीक है, तो जहाँ से फोल्ड होता है लिम्ब, that surface is called the flexor surface. Opposite to that, the posterior surface of upper limb, means this is the posterior surface of the upper limb. Same way anterior surface of the lower limb, it is called the extensor surface. Folded है upper limb, तो उसको extend करना है तो कहाँ से होगा? ये surface का रोल आएगा ना, तो it extends like this. So it is the extensor surface. Okay. Invagination and evagination. Invagination means inward protrusion. So बाहर से शुरू करेंगे तो ऐसे करके 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 सेंटर में आएंगे, तो बाहर से अंदर जा रहा है सेंटर की तरफ, that is called inward protrusion or invagination. और अंदर से बाहर जा रहा है like this, it is called outward protrusion or evagination. Few other terms for solid organ: superficial and deep. Superficial means toward the surface and deep means inner to the surface. बाहर की तरफ जो है उसको superficial बोलेंगे और जो अंदर की तरफ है उसको deep बोलेंगे, right? For indicating the side, ipsilateral means of the same side and contralateral means of the opposite side. Same side का है तो term use होगी ipsilateral, और दोनों opposite side के हो तो term use होगी contralateral. For the hollow organ, जो अंदर से organ hollow है उसके लिए word use होगा interior and exterior, inner and outer. Then next two terms, central and peripheral. Central mass of the body में होगा उसको central बोलेंगे, और जो border पे होगा periphery पे होगा that is called peripheral. Okay, okay, so it's more than enough for the very first lecture, I think. So we will continue this lecture from the slide in the next video. Till then, thank you for watching. Revise this video repeatedly so that you can understand in a better way. And same, subscribe, like and share the videos to help others. Thank you.